Good day, I'm Zeril Eka. Today I'm going to perform the health assessment and physical examination of the cardiovascular system. Procedure number 1. Assess the client physical and psychological aspect before and during examination. Rationale, allow healthcare providers to gather complete data about the client health status. Good morning, ma'am. Ano po pangalan niyo?
Nag-raise nila po.
Okay lang po kayo ngayon, ma'am?
Okay lang po.
Thank you. Review the body areas to be examined. Rationale, health examiner, healthcare providers identify which part of the body is to be examined systematically. Make a physical and environmental preparation before examination. Rationale, proper preparation of the environment, client, and equipment ensures smooth physical examination with few interruptions. Gather and take health history of the client. Inquire for any health disease. Rationale, to have a comparison with previous illness and present health condition. Ma'am, may sakit po ba kayo sa puso, ma'am?
Wala po.
Sa family niyo po?
Wala din po.
Thank you. Conduct physical assessment of the abdomen using the 4 skills in assessment: inspection, palpation, percussion, and auscultation. Rationale, to assess and determine and identify abnormal findings in cardiovascular system. Assessment, inspection, and palpation. Simultaneously inspect and palpate precordium for the presence of abnormal pulsation, leaps, and hips. Locate the bulbs areas of the heart: aortic, pulmonic, tricuspid, apical, or mitral. Normal findings: no pulsation, no leaps or hips. Abnormal findings: pulsation noted, diffuse leaps or hips, indicating enlarged of overactive right ventricles. Inspect and palpate epigastric area of base of the cerium for abdominal aortic pulsation. Normal findings: aortic pulsations. Abnormal findings: bonding abdominal pulsations. Assessment auscultation. Auscultate the heart in the 4 anatomic sites: aortic, pulmonic, tricuspid, apical, or mitral. In every areas of auscultation, distinguish both S1 and S2 sounds. Normal findings: S1 usually heard at all sides, usually louder at apical area. S2 usually heard at the all side, usually louder at the base of heart. Systole, silent intervals, slightly shorter duration of the diastole at normal heart rate, 60 to 90 beats per minute. Diastole, silent intervals, slightly longer duration, the systole, and normal heart rate. Abnormal findings: increase and decrease intensity, varying intensity with different beats, increase intensity and aortic area, increase intensity and pulmonic area, sharp sounding injection clicks. Wait lang. Okay. Assessment carotid arteries. Palpate the carotid artery one at a time using extreme motions. Rationale, this ensure adequate flow through the other artery to the brain. Normal findings: symmetric pulse volumes, pulsation, trusting quality. Quality remains same when client breaths, thirds, heads, and change from sitting to supine positions. Elastic arterial wall. Abnormal findings: asymmetrical volumes, possible stenosis and thrombosis. Decreased pulsations, increased pulsations, thickening hard, inelastic walls. Ma'am, pwede upo po kayo, ma'am. Okay. Next, auscultate the carotid artery one at a time. Normal findings, no sounds heard on auscultations. Abnormal findings, presence of bruit in one or both arteries suggests occlusive arteries disease. Assessment jugular veins. Inspect the jugular veins one at a time for distensions. Normal findings, veins not visible indicating right side of heart is functioning normally. Abnormal findings, veins visibly distended indicating advanced cardiopulmonary disease. If jugular distensions is present, assess jugular venous pressures. Rationale, the external jugular veins is more easily affected by obstructing or kinking at the base of neck. Evaluation, make findings of health assessment and physical examination done on the client. Rationale, this important data to convey the physician to aid in diagnosis of the patient. Documentations, record and report any pertinent findings found during assessment to appropriate personnels. Rationale, to provide accurate data in the care of client.